So next session will be taken up by Teya is also here. Yeah, Teya. And I welcome you, Teya. Teya is the creative director of ATHI. She is a multidisciplinary artist with a special focus on fashion. And Teya is currently pursuing a fellowship in management and trans empowerment from TISS. We welcome you, Teya, to take a session on what does my ideal mental health practitioner look like. Welcome to the dais.
Hi everyone, I think we're doing this with Dr. Kavita, so can I get two handheld mics actually, and we can just sort of sit here and yeah. So the general idea, I think while the mic is happening, I'll just sort of briefly brief you all about what the idea behind this is, right? So let me give you a little bit of context for me. As a trans person, and also as somebody who's been in therapy for a majority of her life, I feel like I have just a lot of consumer experience. Like, I know what I'm talking about because I've done a lot of it. And that's what sort of gives me any amount of credence to talk over here. I think we wanted to structure this session as sort of an informal chat. I didn't want it to just be me coming up here and, like, you know, going off on like a long sort of like conversation. I wanted it to be like a conversational thing. So yeah, I think the mics have happened and we can get started.
So why don't you come here and I'll come here. Okay, so
It's on? Yes.
it's on.
Audible? Hi, good morning, hello.
And this one's also on?
Yeah.
Wonderful. Okay. So my request would be, right now we are going to try and have a conversation. So we'd like you to be active listeners, and at the end we'll have an interaction.
Yes.
But please keep your thoughts, your comments in till the end. Yeah? Okay. Hi, Teya.
Hello. Hello.
Okay, so we are doing a little bit of a retrospective, historical thinking aloud as well. Yeah. And the mandate that I'm putting forward today is to discuss and share your experience rather than just talk about what an ideal person would be, because I think you come from an experience at different stages and ages in your life. So I'd like to start from when you were much younger.
Yeah.
Yeah. And understand from you that as a child, as you were growing up and when you understood things were different, was there a concept of healthcare service or help from? What was your concept of there could be someone out there helping?
So I think when I started like figuring out about my own gender expression, the landscape of conversation around both like mental health and transness was quite different. We're looking at sort of 2008. I must have been in the 8th grade when, which is when I think my parents first realized that I needed like some form of intervention or care, because a lot of the ways that I was acting was manifestations of trauma, of mental illness, etc., etc. I think there was a lot of acting out, there was a lot of lashing out, there was a lot of angst, and I think I can pinpoint this to when, you know, puberty sort of hits and you realize that your body is going to be like the first site of betrayal and you're like, wait, this is not going how I want it to go. I think during that time, it was a lot of acting out, it was a lot of like anger, right? And nowhere to put that anger. So I think back then, we first started off, as I think most families with that access, like, you know, before we get into it, I think what Deepika had mentioned was really fascinating, is that despite the fact that we come from the kind of class and caste section where this was like a normal thing for us, because both of my parents are doctors, right? So the idea was that, oh, if this kid is acting out, the notion was there. Mom works in a hospital, mom has psychiatrist friends, mom has psychologist friends. So the idea was that help is available. Let's go take that. I think the first person I ever remember like seeing for anything was one of mom's colleagues at the hospital. And I think just right over there is where the idea of like what an ideal mental health practitioner, like, so that's why I wanted to have this conversation, because I don't want to make it seem like one thing is right and one thing is wrong, right? There is no such thing as an ideal mental health practitioner. I think kind of burying the lead over there. But I think it's circumstances that shape us. Now, this person was a consummate professional, but then just by virtue of him being one of mom's colleagues, there was so much that I felt like I couldn't share. So, you know, there was a perceived lack of objectivity from me, the patient side, where I was like, oh, this person cannot be objective about what I am going through because of his relationship to my mother. And to explain to a teenager that like adults can be objective or trustworthy, it's very hard. It's a sort of double bind, right? You're supposed to trust these people, but then if there is that precedent for trust hasn't been set, how do you sort of do that?
So you're bringing up something which is extremely important, which is not necessarily that at that age, what you were not looking at necessarily was competence or qualifications. What you were looking at was, can I trust this person?
Absolutely.
So that there, I think for me as a mental health professional, I think if I'm able to hold that a 14-year-old or a 15-year-old coming to me is not looking at whether I'm MD psychiatrist or clinical psychologist, or that doesn't matter. Knowledge is not the first thing that a young person's looking for. Thank you for saying that. So can I ask then, to carry on from here, how did you learn to trust?
I think, okay, so we came to Delhi, this thing from, this was in Chandigarh, and I grew up in Chandigarh, and the second person that we then saw, we sought out a specialist in Delhi, right? And every week the family would bundle into a car and we'd drive up to Delhi from Chandigarh for my psychiatrist appointments. And the highlight of those appointments would be that I would get frozen yogurt before and then mad over donuts after. And also the office where the therapist would be at had like a bunch of like, just like toys and like puzzles and whatnot. And I was content. I was like, okay, this is like a road trip. There's an activity. There is desserts involved. So, you know, kids are very easily mollified. And also I think kids who are struggling with their mental health issues, there is so much that's going around there. And not to make light of like a dark time, but I think that is sort of the only way that I think that trust came from the fact that this was a stranger that did not really have any incentive to, I was like, this person doesn't know me, doesn't know my parents, right? And then that very tenuous bond of like forming that relationship. And I think that just the way that the healthcare facility was set up, you know, that helps a lot for like a traumatized or a troubled child, where the space feels inviting, the space feels welcoming. You know, it was in a residential area, so there was like not a lot of that like clinical aspect of it, which was not the case with the very first psychiatrist that I saw, which was in a hospital. And it's a very imposing thing. You're like, oh, something is wrong with me, I'm being taken to the hospital. You know, whereas this was a facility in like sort of like in GK actually, so it's like a residential area, nice area, mad over donuts, you know, all of that. So I think that was again like a long-term association. We'd come up to see this person, and so that is sort of where the foundations of that began.
Got it. And so you've been, from what I'm hearing from you, you've been through different kinds of professional interfaces by now, yeah?
Yeah.
And I'm supposing that it's not just mental health, because all of us also have physical health interfaces as well. So it's a multiplicity of interfacing with mental health.
Absolutely.
Any sort of thoughts or any things that stand out in these multiple interfaces for you?
I think it's really funny that I think back about it now, and I, just as a kid, I've probably been given like every single mental health diagnosis in the book by like various different medical professionals. And like it'd be really funny to come back home from those appointments and have mom sort of be in the car like just muttering like, no, this is not right, this is crazy. And then I think my parents and I have always shared like a very frank relationship. I think that is there, that like, you know, despite everything we talk about it. Mom was like, oh yeah, this one thinks you're schizophrenic, but you're not, it's okay. Oh, this one thinks that you have BPD, but like we're pretty certain you don't have BPD. Let's try these meds out though. And I think that, and this is where I wanted to highlight this, right? This thing, and I can talk about all of this quite candidly now, but I do think that this is again where, without having any judgment, I think this is why it's so important for mental health care professionals to be sensitized about transness. Because I think from the 8th grade till like the time I met you, spoiler alert, Dr. Kavita was also a therapist and was my therapist actually, and was the last therapist that I ever saw, which is quite cool. But I think what I wanted to circle back on was that this is why it's so important for mental health professionals to have context and have knowledge about transness. My narrative did not change since I was in the 8th grade. You know, thankfully I had supportive parents who were able to pull me out of certain situations, certain doctors, because they were doctors themselves, which is something that not a lot of kids out there have. Not a lot of adults also. Adults get stuck with healthcare providers just because they don't know better. And they get trapped with these, not, well, trapped is a very loaded word, but you know what I'm trying to say. Like, I think that I was lucky that my folks had contacts and were able to get me out of situations where they were like, okay, this is not what our child is. We don't know yet, but we'll figure it out. We just know that this is not what it is. But that damage was still being done, right? I was still not receiving the care that I needed. And it came to, like, I want to say, like, there was a breaking point. There was a breaking point where finally it was, when we came to you was because there was a referral from, like, the one trans person I knew. And I was like, where are you going? What are you, I want this actually, and nobody else seems to believe me, but where are you going? I'm gonna go there. And that's how we end up coming to you, because the idea that there could be somebody who was trans affirming, you know, so I've been in mental health care facilities in Delhi, Bombay, Chandigarh, and then back to Delhi, the Signal Gurgaon. So I think like my main thing was that I didn't need all of those other medications. I just needed estrogen, and I think that was the first time that somebody recognized that a lot of the mental health symptoms that I was exhibiting were symptoms and weren't the cause. Like, does that make sense? It was that my depression didn't stem from anything else. Like my anger wasn't like an inherent thing in me. It was the anger of a child that wasn't being heard. And I think once I had that space to be heard and to explore those emotions in a safe space that was therapy, I would like to think I worked through a lot, and you know, I worked out a lot, and was able to sort of come to a space where I can talk about these things a lot more objectively.
Yes, oh yes, that's precious.
This is also, can I just say for everybody, this is like insane, because I have to like stop myself from, I'm like, oh, this is not therapy. Like, there are people watching, and you know, this is that. So
yeah, and I have to stop myself from saying, can I say something?
Oh,
and say,
no.
hey, I hope that's not going to be triggering, but you know, it's lovely to have this conversation.
It's great. It's great. Full circle moment,
yes,
actually.
Yes, absolutely. And somewhere along the line, I wanted to apologize for our medical community to you publicly, to say,
oh, no.
My God, look at that journey, because yeah. But
no, but you know, actually, but that's precisely why I didn't want to sort of get up and talk about like an ideal, right? Because I think when we say what does an ideal mental health practitioner looks like, I think what we're also trying to say is that we're trying to build a community of people that are actively listening, that don't treat their patients as somebody who can be discredited. That I think that there should never be a power imbalance. I think that there should never be a power imbalance between like a healthcare provider and their patient or their client or whatever, because it's still a human being treating another human being. And if you have knowledge, then I think it serves everybody's best interest to try and come at it from an angle of compassion and not like dismissiveness. And I don't want this to be one of those things where, you know, we sit up here and we slam healthcare providers, because as a 27-year-old, I can now look back and say that, you know what, even the doctors that did not give me the care that I deserved, I don't think that they necessarily did it maliciously. They just that they didn't have context, you know, which is why something like this conference is important, and which is why I just want to say that it's a big thing to see like practitioners here to like listen to people from the community, because it would be very easy to say, oh, I've gone to medical school and you know what, I know better and it's whatever. How dare you question me? Which is, that sort of defensiveness can sometimes come up. But I think it takes a lot to put that down and be like, no, actually, I think we might have not been doing the best job for a bunch of people. Maybe we want to listen to what they have to say and take that feedback. And yeah, so I think like apology appreciated, but I don't think it's necessary. I don't think it was something that was.
That was mine, not a need from you, but that was just something that occurred to me. So, what do you think, Teya, were some of the protective factors? And I'm also now looking at the audience, looking at people who might watch this later. And you've talked about trust. You've talked about being child appropriate or age appropriate as a facility. You've talked about, you've also hinted at how misdiagnosis can happen over a period of time and how that may actually impact and mean something to the young person. But you also had a very supportive, very knowledgeable, very aware family, yeah, with excellent communication and a relationship with them. And possibly the privilege and the opportunity to go to many different professionals.
Absolutely.
And
Absolutely.
to be having that. But what do you think are the things, if you look back, or as at 27 today, what do you think are the protective factors? Because oftentimes we, like you said, we try and look at things that we can slam and blame and say we've got to correct those. But what is it that was happening that was right in the community, in you, in parents, in mental health care provision?
I think that over here, what gave me the power to sort of like even stand up to, I wouldn't even say stand up, I think it's just about like being able to turn to my folks and being like, this is like not right, is that the older I grew, the more queer friends that I gathered, right, the more I made a connection with community. And again, online community, at least it was for me, it was online community. I grew up on the internet, I grew up reading about like transness, I grew up like having that context, and I've always been like a ludicrously confident child where I was like, no, something's wrong with everybody else. That is one thing that I'll be very like frank about, that even when like professionals were telling me, no, you're incorrect, I was like, actually, I don't think so. I read it on the internet, and maybe the internet knows more than you, which not a good thing, by the way. Like, don't trust the internet over the word of like credited medical professionals, duh. But I think that it was something that gave me the confidence to be like, no, but I don't think that this is what I need. I think in terms of what went right was that having that space, you know, whether it was at home, whether it was online, whether it was through physical friendships, whether it was through seeing other community members. I remember in the 12th grade, like we'd finally moved to Delhi, and so Delhi wasn't just this like mystical place from Chandigarh where like, you know, I'd come once a week to like sit and grab some donuts and cry. Delhi became a very real space, and I attended pride parades. I started interacting with other trans people. I started interacting with collegiate people, you know, people who were going to college, academic people, and I realized that yeah, that there is space out there for me, and I think that is when I was able to sit in my transness a lot more comfortably. So it became even harder for other people to tell me that this is not what you are. So I think yeah, like for me, what went right was community. What went right was trusting in the word of people who are like me. And I think which is why community building is so important. And I want to keep like going back to what Deepika said, because she really started us off with such an important thing, you know. It is that I recognize that like us sitting here and like talking about this, and me talking about this is an exercise in like privilege, is an exercise in you know, class, but I think for a lot of people that they can fall back on community, that even when their folks are like, हम क्यों जाएं psychiatrist के पास, पागल थोड़ी ना है, तुम पागल हो शायद, तुम चले जाओ, but then they can look at community, they can look at people who are like them and know that no, हम पागल नहीं हैं. And I think on a smaller scale, that's what I was going through, where like it was very isolating to have like adults tell you that no, you're insane, take these pills. But then to like maybe have that one person, two people in your life, even if it's on the internet, be like, hey, no, it's okay, you're not crazy. So I think community is what yeah.
Thank you for sharing that. Yeah, I'm just staying with what you said in terms of community, and also realizing somewhere that the language we use on a daily basis, or the superheroes we don't have, or the ordinary heroes of everyday life that we don't talk about. How that might invisibilize possibilities for children growing up who want to look at, what can I be when I grow up? Who can I be? Are there other people around me? And yeah. That.
No, but you know, I swear to God, I don't want this to be like a thing, but like, I think for me, like, you were that superhero. And I genuinely do mean this, is that I wanted, like, when we talk about what an ideal mental health practitioner looks like, right? I think Dr. Kavita, and I can say this like quite frankly, was the first person in that space after all of these years who I felt like listened to me, who wasn't outright dismissive, you know, who didn't look at my condition. And we have to understand that like traumatized people are a lot, right? And it's not going to be picture perfect. It's not going to be always be coherent even. You're going to have clients who are not going to be able to express to you what they're going through, but it is your job as a practitioner to be able to decipher from the chaos. And I can talk about this fairly candidly, and I will carry this core memory with me. I was quite literally in the middle of a nervous breakdown during one of our sessions, and I think like that was sort of the breakthrough moment for me, where the very next time that I came back around, because despite the fact that I'm quite literally losing my mind in like a therapy session, I never felt judged. I never felt like this made me a bad person. Whereas, you know, earlier on, like, you cry a little too hard and they're like, okay, cool, go. This is over. Please don't come back, actually. Which is a real thing, you know, and it's funny to me now. But I think just the fact that I was able to come back to you and like still pick up as if like I wasn't not in touch with reality the previous week, that meant a lot. That meant a lot. And I think, yeah, just sort of coming back to the idea of like being heard, right? And like having somebody take that anchor. And I think for me, when I came to you, my anchor point was this like need to transition and to be like, okay, I am just here for a certificate. And you could have done the bare minimum, sent me off with that certificate, and that would have been that. But you said, no, actually, you know, we must like talk about this first. Because when I came to Dr. Kavita, by that point, I was in like severe trauma from like just going through multiple mental health professionals, trauma from just life, trauma from not being able to access, you know, the healthcare I needed to transition. So you said, no, we're going to sit and we're going to work through these things first. And then, you know, when we get to this point, this thing, we can like get that GID certificate. And that is something I'm very thankful for, because it takes a lot to, I feel like, not just turn away people or like to like do like lip service, you know. And I think that there are a lot of people out there who would, you know, just like be like, okay, cool, you need the certificate, go. And that's not an ideal mental health practitioner. That's another thing I want to talk about. You know, this thing we spoke about, mental health practitioners being like sort of the gatekeepers. And while I do think that that is ridiculous a little bit, I think that itna nahi hona chahiye hai. Like, it shouldn't be this gate kept, like transitioning. And self-affirmation of your gender should not be gate kept by anybody, absolutely. But I think what should be there is this idea that when you recognize that somebody is traumatized and they are unable to articulate it for themselves, you should have the willpower to want to step in. That's what makes an ideal mental health care practitioner, is this idea that you want to actively help these people. I think that's what I keep coming back to, is this very innately human thing of compassion. I think it's because Dad, when he started this, like really held on to the idea of the Hippocratic Oath that like all doctors take, right? And it's this almost like sacrosanct thing. Like, it's not bound, it's not written down anywhere. It's not like not codified is what I'm trying to say. But something, it's an ideological thing. And I think that's what makes like a ideal mental health practitioner, is that no, I'm going to help you because I can.
I want to help you because I can. Thank you. Thank you. Thank you for that. I don't know where to go from here. I think this is so complete in itself, because it talks about how to use your privilege as well. And I mean, I learned today many things, Teya, again, as I did from every session and every conversation we've had. So thank you so much.
Oh, not at
Any
all.
last sort of comments or things that you might wish to say, please feel free.
No, I think that, I mean, nothing new to add really, but I just want to keep like circling back to what we've already touched upon, right? That I think that there is no such thing as like an ideal. I think there is no point in sort of, but there is a point in pursuing that ideal. I think that is for sure. I think the idea that we must use our privilege, we must use what we have to help other people. I think this conference is a testament to that. That nobody had to do this, right? Like the state of healthcare in this country could have been left as is, but it took like a few people galvanized enough to be like, no, actually, we're not happy with this, we're going to change it. Because I think, just how Deepika mentioned, the people with privilege were able to access things, right? And it could have, like, that's usually what trans healthcare in this country was for a very long time, is that the people who had money could just go outside and, you know, do that. But the people who don't have that money, people who don't have that privilege, people who don't have that access even, because they can't talk in English, they don't dress like us, they don't, so they were left to, and I say this with no uncertainty, charlatans and hacks, right? And that's not right. I think that is something that when we sit here, we must understand the sort of enormous weight on our shoulders. Is that to fail now would be to fail so many people. And that's not okay. We can't let people like slip through the cracks like this. I think that anybody who's sat here today, especially from the medical fraternity, has signed like a little blood contract with me. No, this thing, I'm just kidding. But it is an unofficial thing, yeah. Like, come on now. Just your presence over here, means that you care. And that you are willing to do better to change systems in this country that have been unchanged and unchallenged. I think to be in a medical college like Jamia is such a huge thing. Like this is mainstream. We're in the mainstream. We're talking about these things that a lot of people would rather have be hush-hush. And to bring these out, to see like so many queer people on this campus, I think it's fantastic. To see so many openly trans people on this campus running this thing is incredible. And I think, yeah, just in closing, that's all I have to say really. That there is an enormous responsibility and we have all agreed to shoulder it. So yeah.
Thank you.
Not at all. Thank you, thank you, thank you.
Open for any audience interaction.
That's
Yeah?
yes. Hi, hello.
Yeah.
Yes.
Yes, Dr.
Yes, ma'am.
Can somebody, maybe, Teya, I'll get the mic. Okay. Right. Thank you.
This question earlier also, and we had discussed this question to some extent yesterday also. As a parent, I want to know, when do we start the dialogue? And as a medical professional also, when do we start the dialogue with the parents, with the children, about gender, about sexuality, about queerness, or in general? So when is that time to start the dialogue? So that, you know, that trauma that goes on for such a long time, because first the child is in the closet, and when the child comes out of the closet, the parents go into the closet. Okay, so that the closeting does not happen. So when do we start the dialogue? That's one part of the question, and after you have answered, I'll come to the second part.
Thank you so much, ma'am. I'm just kidding. That's my mother. This thing. Hi, mom. Hi. No. Dr. Kavita, would you? Or can I? Okay. I think I'll start this off. I think. Okay. So my controversial opinion on this is that it doesn't need to be a conversation that's starting, because queerness is it's ubiquitous. It's just a part of life. Gender, sexuality, this thing, it's a part of life. And the idea that there is a gender binary, that's unnatural to me. But, you know, the conversation about gender binary is something that gets started, and then we have to do a lot of work like unlearning that. I think that if we gradually move toward a society where we stop saying things like, you are a boy, dress like this, talk like this, you are a girl, how can you go here? You know, it's these little things. It's these little things that, if you raise your kids in a truly gender neutral household, where you just tell them, yeah, sometimes people are queer, and you know, that's it. It doesn't even have to be a big thing. Like, yeah, sometimes people are trans. We had this yesterday at the cultural program, actually. There was this really cute child and she wandered backstage. And, you know, children, my God, have absolutely zero filters. And it's because, like, they truly see the world for what it is. This thing she pointed at, one of my friends was like, "Aapke baal lambe hain, aap girls ho. अच्छा पर आपका तो आप आवाज़ ऐसा है, आप तो boys हो, लेकिन फिर आप girls की तरह क्यों खड़े हो?" And it's this idea that, you know, as like trans people, why this happens is that we're like, oh, we're seeing the process of indoctrination of like the gender binary in process right now. This child has already been got. Like, she already thinks that there is a particular way to be a boy or to be a girl. But when she sees a real life example of that clashing, she's like, wait, what is this? Right? And I think that if we raise our kids in a way that doesn't have to be, like the gender binary doesn't have to be this like all-encompassing thing that their parents teach them, then there will be no trauma. There will be no, right? I think, sorry if this gets like a little too hippy-dippy.
So,
oh yeah, absolutely. I think gender on birth certificates is a lie. I think you don't need to have gendered birth certificates, and I'll say it right now. Like,
I love the absolutist bit
oh,
of it.
hello. I hold the mic. I have all the answers.
So, like,
I think it's a very important question, Dr. Bela. I'm
Yeah.
going to take a minute to try and dissect it as I do. What does dialoguing mean?
Yeah.
Yeah. If we mean a verbal dialogue,
Yeah.
I think a dialogue or an exchange with a child starts before birth.
Exactly.
Yeah, in the womb. Will it be a boy or a girl is the dialogue we are having with the unborn child. And the child is not yet responding, but that's where the dialogue is starting, according to me. So I think the dialogue is more about who's starting the dialogue, and therefore it is not really about the child, in my mind. It is about the adults. It is about the social structures. So the dialogue has to start there. That's my understanding. If we are talking about verbal dialogue, and if we are saying dialoguing means when do I start talking to the child about gender, my answer today, this wasn't the answer 10 years ago, but my answer today is when you start dialoguing. When the child starts talking, and when you start as a parent or someone who's talking to the child, if you're starting to talk to the child verbally, then right from the beginning, and this is not just on the dimension of gender, it is in any dimension. If we are able to bring diversity into our language, into that dialogue, if we are able to bring respect, compassion, and intersectionality into our dialogue, then many of these problems of distress due to the interface with social versus internal, these problems will decrease. What will that world look like? I don't know, because I've not grown up in it. But that's my opinion for now.
So, what we thought that if we have birth certificate which says that sex of birth, sex assigned at birth is male or female, whatever, looking at the child's genitalia, gender to be decided later.
Wonderful.
So that would be starting the dialogue with the parent.
Absolutely.
At the childbirth?
Yeah.
Would that work?
So again, I would say would not just work, it would be the start. It would be the start of starting that conversation in, for example, the person who is printing those birth certificates today,
Yes, yes.
who is an adult, The person who's filling up the birth certificates, who's not a mental health or a medical professional, who's sitting at one of the offices and filling it. So I think these are the cues and invites that we have to put out there today in our social structures because of current context.
Yes.
I think 10 years ago, 20 years ago, if we had raised this question, it would have looked very different. But we are in the middle of I believe, a transition period.
Yes.
And if we are not able to put out these invites now, and I think the birth certificate is one of those invites, that is, while it is a birth certificate, it's not really for the child. It is for the adults. And I think, I firmly believe it is not about the child in the beginning. It is so much more about how in our mindscape we are holding these stereotypes.
I think Man had a question as well. Mike?
I want to talk to you. So, thank you, Dr. Kavita, because what you have brought up is really true. Through my personal experience, I'm a trans man myself. So, would like to share this, that coming from an Indian culture, boy-child has to be one of the concepts that has strongly been put across for centuries now, right? And something that my mom had to go through, and this is a personal experience, but I got to tell you this. So she happened to very strongly believe that she's going to have a boy child. Okay. So what you brought up was in the womb, and it wasn't her fault, of course. It is also coming from her learnings, teachings from her ancestors, as what was told to her, that she needs to have a boy child. That's the pressure that she had. Okay. Eventually, when I was born, I got to know as an adult that my family was so disappointed about the fact that a girl child was born. My mom didn't happen to take me close to her in the hospital for weeks. So I was already in a place where I was on my own, right? Post which, today, my mom is the managing director for the Teya Charity Foundation. So she happened to be, not just her, but my entire family, to be excellent acceptance throughout this time and my transition. But I think that's why endocrinologists or gynecologists, even those doctors who have the access to parents, new parents, maybe can put this idea to not generalize, to not be over prepared for something like this, or just say that it's just going to be a child. And I'm glad that the government has no gender policies now, but it is here that has to change. It is here, and maybe through the access of good gynecologists coming across, helping the transgender community, understanding the transgender community can make a difference here. So I completely agree to what you said, because I've personally experienced it, and it's not my mom's fault. It's no one's fault. As parents, it's no one's fault to be excited. But eventually, there has to be some impact on that. Baby who is not born with the gender comes later. The certification comes later. What we are trying to do here, female, male, transgender, third gender, is all comes later. It starts right from your family, from your mother. And I am glad you brought up this topic, because that's where I felt it all started. But yeah, it's not our fault. And we keep, as trans people, we keep asking, यार मेरे साथ क्यों हुआ? और parents फिर सोचते हैं कि मेरे वजह से हुआ. So I'm thankful for Sweekar group as well, who are helping the LGBTQ community understand that it is not the parents, it's not the community, it's not your child's fault as well. It is happening, it's happening. Just let it happen, let us live, you all live, everybody gets to live.
I think like that's a very crucial thing, right? That the idea of blame, and which is precisely why I wanted this to be like a conversation with all of us, is because I'm not interested in assigning blame anymore. When I was younger, full of anger, maybe yes, but I think as adults we realize, and that's what I want to keep coming back to, that even the practitioners that might have been less than ideal to me, some of them unethical, but the thing, but like even then, I think that the idea is that we grow, where we're changing, and we're in the middle of, I would say, like a global conversation about like queerness, about transness, about gender. Like these conversations that we are having today simply did not exist 15 years ago. I think it's very important to remember that we can't retroactively assign blame. We can't retroactively be like, oh, this was somebody's fault. The system was like this, but it's upon us now to change that system.
Yeah,
And-
Teya, I agree. And also one thing that you mentioned was that this has been happening for years now. This got to stop and change somewhere.
Absolutely.
And this platform that WPATH has created gives us a voice to come out as queer people to step up and say, this is what we are going through. Can you help us? We can help ourselves. That's not the problem. But there are certain ways where you can incorporate certain rules and policies in the education center also. I've been dealing with psychologists, and gender is just one of the chapter. And there is nothing more said which defines the entire LGBTQ, the queer community. So more of that has to be incorporated at the educational level as well, where the endocrinologist, psychologist, anybody coming out is already aware that because this is the change. We need to add, we cannot have the same syllabus going on for years. Things got to change, right? So yeah, thank you so much again, Dr. Kavita and Teya, for putting across this. Yes, psychologist.
Okay, so hi everyone, I'm Meenakshi Verma. I'll not waste more time about, in introducing myself, but I'll add something to what you said. The idea when we put a label as a victim, persecutor, rescuer, we are actually identifying that person. There is this idea, whole paper on it as well. I'll share it with you if you wish. But the thing is, it's very important to understand that, trauma actually heals when you move out of that cycle, that role that we play of a victim, persecutor, rescuer, and then a, victim, persecutor, rescuer. So when you come out of that role is when you actually heal from a trauma and you come out of something. That's when you transcend or you empower yourself. So that's, I think, very important, and I appreciate the fact that you actually took ownership of your trauma and responsibly came out of it. So thank you so much.
Thank you.
Just one thing I want to add here. 15 years back when I'm here.
Hi, Mom. Hi, sorry.
Just so 15 years back when I conceived my child, and because me and my husband were alone in Pune, and we happened to attend the prenatal classes offered by the Nanath Mangeshkar Hospital. Now, as we were talking about education, awareness, I think this is something should be the part of prenatal classes as well, wherein the parents, prospective parents will understand that yes, there is some possibility that they may begin this another journey. Like Dr. Sanjay Sharma has talked about that certificate, that gender certificate, that should be given later. Similarly, I think somewhere we have to prepare minds of those prospective parents right from the prenatal classes that can help to prepare and have awareness that yes, this can happen with the child that I'm carrying. That's all.
Oh,
Thank you.
absolutely.
Wonderful.
Yeah.
Thank you so much, Dr. Renu. And Dr. Sanjay.
See, it's very important that dialogues happen.
Yeah.
Dialogue need not be correct as what people may put correctness as. Because when we say correct, it is got a context to time and space and people where this is being said. And times are changing. People change. We all grow. So dialogue is very important. It's very important that this dialogue starts before -9. In fact, it starts before -3. Because when we are growing up and we in our mind are becoming parents and we are thinking about the life that we will nurture, we are, molding the universe around us. So dialogues need to start in educational institutes, where the minds are there. And if we succeed, I would say, what would you define as success of this conference? I would say that if a young person, even one, is ready to start a dialogue, we have succeeded. No. And we have,
we can clap on that. We can clap, that's okay.
Thank you for that. And that also tells me to shut up and say that, look, care needs to be given, and anybody who is in the business of care needs to be ready to unlearn what they have learned and believe the narrative that is being put forwards. First and foremost, establish trust.
Yeah.
That is the most important thing.
Absolutely. Oh, Dr. Lin has something to...
Yes. Dr. Lin. Sorry, Anjali, you'll have to keep standing there for a bit.
Thank you so much. I want to say that for me, this has been one of the most important dialogues of my career. To actually be here in person. I have participated in so many online things, which are great, but and also in WPATH, bringing in, hearing a talk from a small group of people from a country. But the idea of actually myself being here and listening to you and listening to what I can take back to my colleagues is, it's overwhelming, actually, because the differences that I saw in terms of how you opened the conference, the care that I am seeing among people here, the honesty. It's so honest. At least I think it is. I mean, what I'm hearing, I mean, in terms of the dialogue, I think this idea of conversation and dialogue, I would love to continue this kind of thing. The conversation the two of you had, I haven't seen that before at a conference. And to hear openly what happened and why and what's important, the whole idea that what's important is honesty and trust. Of course, that's so basic, but I haven't heard it in terms of trans health, the way the two of you were talking. Teya, the way you were just so open about your experience. I learned a lot from you. So thank you. Thank you all. So I just wanted to say that as a mental health professional myself. Emerson, I don't know.
Hi, I'm Emerson, and I'm a clinical psych from Australia. And I am trans, non-binary, and I think one of the things that I would like to say is this has just been amazing, honestly. Like, there's just been moments that have just, I wish, if we've got a copy of, if I can get a video of this, I want this conversation to be seen by so many mental health practitioners, because it has been absolutely amazing. The other thing I'd like to say is I have a 10-year-old, and I have brought him up quite gender neutral, and the conversation started well before he was born. And I think it's a success when he rolls his eyes when I say, you know, you can be anything you want to be and I'll still love you. And he's like, I know, I can change my gender. I can love who I want to love. I get it. And I think that is when my son knows that no matter what happens to him, that he will be loved and have family. I think that, and that has come from him being able to choose everything, toys, what he plays with, what he's interested in. There has been no boundaries, and he sets his gender identity, sexuality, his person. He gets to be who he wants to be. And so I would say that it's working. So I encourage you all to do it.
Thank you.
Thank you. Well, I'm Seema, and I'm teaching at Nursing College in Jamia Hamdard.
Hi, Seema.
Hi, ma'am.
So it's about like, I'm not mental health expert, but still my question is, as Emerson said, and as others are saying, Mansi also mentioned that dialogue has to start well before birth. I would like to ask, are we, like forget about that when child is, fetus is there in the womb, after that, when child starts understanding, like 2 years old, 3 years old, and if we start talking at that time, that okay, you be whatever you are, accept the gender, we will accept you, we will love you. Aren't we? I do not know, I'm myself confused. So aren't we making that child more confused about, because will he understand about gender at that tender age? Or we are putting some seeds of confusion in his mind or her mind, or whatever we call it, whatever pronoun we use. So, if I may know.
Yeah. So, ma'am, actually, I think the thing is that we tend to, as adults, not give kids enough credit. And I think we shouldn't make that mistake. Kids are very smart, kids are very perceptive. Also, the concept of gender and the idea that adults can choose to be who they want to be is not a difficult one. It's like telling a child, ठीक है, आज आपको toy car के साथ खेलना है, आप खेल लो, कल अगर आपको doll के साथ खेलना है, आप खेल लो. That is a very simple thing to tell a child, and also you're not confusing the child when you tell them that actually do whatever you want to, I love you. Because the confusion comes when you've been told your entire life, hey, as your parent, I love you. But if you do this ना, घर से बाहर निकाल देंगे. अगर marks नहीं आए ना, तो मार पड़ेगी. Confusion तब आता है child को, because to a child fresh out of the womb, the one unmistakable truth is the unconditional love of their parents, of their family. A child knows nothing else but that. Like that is the most sure thing a child is, and the confusion comes when the child is like, wait, but what is wrong with me that these people who were supposed to love me are now no longer loving me? I would say that's more traumatic. I would say that's more confusing. कि मैंने क्या किया, मेरी क्या गलती है? अगर कोई, if a boy, अगर कोई लड़का मतलब आपकी चुन्नी से खेल रहा है and suddenly the mom catches them and like gives them 2 thwacks, that's more confusing. Like, wait, why am I being hit for playing? Why are certain forms of play okay? Why is it that I can play dishum with the boys, but agar main chudiyan dal li to mummy maregi? You know, why can I like roughhouse with the boys, but the second that I dress them, why am I being? Or with girls, it's like, अच्छा ठीक है घर घर खेल सकती हूँ, पर अगर मेरे को भैया के दोस्त के साथ फुटबॉल खेलना है तो माँ कान पकड़ के घर में घसीलेगी, ऐसे कैसे कर दिया? I think that's more confusing. But if we approach it with just, yeah, it's cool. Sometimes girls play around, sometimes girls climb trees. Sometimes, you know, boys don't want to, sometimes boys want to play ghar ghar, and that's okay. That play doesn't mean कि आगे जाकर that child will be queer or will be gender diverse or whatever. And even if they are, so what? It's not the worst thing that can happen to a child, I think. Thank you, ma'am. I hope that answers the part of your question.
Thank you, Teya.
Not at all, ma'am.
Because we are also talking about that, when do we start the sex education? When do we start imparting sex education in the schools? We are in that...
What? No. What? No. Stop.
This is
hey,
okay,
no crosstalk.
We are changing the topic completely.
Yeah, no crosstalk.
As moderator right now, because we also have next sessions, we are going to keep it to gender.
Sure.
Not go into sex education, although it doesn't mean it's not an important thing to do.
Okay.
So I'm going to try and close with what Teya said, that, see, in my understanding, gender is very different from gender expression. Yeah? So gender is something you own. You know whether you are male or female or whatever as you grow. You don't need to be told who you are. The telling from parents comes for the activities you're doing, the actions you are taking, almost like expressing who I am inside. I feel like doing this, but can I as a child or not? And I think in that parents guide all the time, not just in the gender dimension. We guide children all the time, and I do not think that we are suggesting for a moment that a parent should stop guiding a child. That's not, and the
absolutely,
child
yeah.
will always grow up in the cultural context of the family, the environment, the neighborhood, the culture. And that is not wrong. What is to be differentiated is that there are certain things that are inherent, innate, and owned by every individual. The personhood and gender as a concept, as an understanding, as you grow, is something that you own. There are people who probably see their assigned sex as the same as their gender, and they have no dissonance. And that's why it's probably hard to understand how somebody can have dissonance about this. I think what Teya is trying to tell you is, if there is dissonance, the child shouldn't be left alone. So the space for a dialogue has to occur from the mind space and the space metaphorically in the family, because that's the first place that the child feels either nurtured or sanctioned. And as soon as they feel there are certain things which are sanctioned and certain things which are out of bounds, that's where the limiting starts. And that limiting of possibility, as soon as you say binary gender, I think that's where the dissonance sits. And I think that's what we are saying. Don't allow that. Don't allow them to think that all doors are closed to anything except binary. That's all. That's the dialogue. Whether they are or not, time will tell.
Thank you very much, Dr. Kavita and Teya. Thank you.
Ma'am, thank you. Thank you for that question. Because I think questions like these are important. You know, these are real concerns that like parents have. Oh, hi.
Oh, yes.
Yes.
Please.
Hello, sorry. Hello, hi.
Sanjay has put me into an awkward position here because I am non-medical. I'm not from India. But he wants my input, or at least my thoughts. And my thoughts, and one of the things that he forgot is I'm an engineer, okay? Engineers look at things very differently from you all. But what I've learned over the years is that the biggest problem that you have in solving a problem is defining what the problem really is. And one of the things that I think about and what I've learned about over the years in different cultures and in our own country, in the United States, is that probably one of the biggest things that comes up can affect transgender health, etc., is the inequalities that we have in our cultures. And you know, the major one is the inequality between males and females. And then it goes into the whole thing with color and race and religion and all that sort of stuff. And the real problem is dealing with that. I think that what you're doing in trying to solve a problem that's related to trans care is something that can actually help in solving that problem in the grand scheme of things. But that's what I'm hoping for anyways.
How much time do we have?
I don't think we have time, dear.
Yeah, I think.
So I'm going to ask the organizers, because I think we've.
Okay,
yeah,
so
just about. Yeah, I'm loving the conversation. I'm going to scrap my talk, Anjali. Yeah, so I think the conversation is so much better.
Actually, that was already included in the interactive session.
I see. So let's take care of that.
We're multitasking.
And yeah, we're multitasking right now. Absolutely, absolutely. So so then over to you. And if we have someone tell us how much time we have before the next session.
Done.
Yeah, Dr. Sanjay is saying done, but then we started late. So I'm
so
going to call upon my
cut the
privilege
mics.
and say we have 10 minutes. So we're going to have one here, and I see a hand at the back. That's two.
Yes.
Anybody else who wants to speak? You're getting
Step
the stage
right up,
for 2 minutes each. Anyone else who wants to speak? Okay, these are the two people, and then I will do a conclusion.
Okay.
Let's go
so
first.
Thank you so much for giving me these 2 minutes. I would first like to begin with Emerson. What he said, you know, bringing up a child in a gender neutral environment is important, because what we are missing is we also hold a responsibility of bringing up a generation of cisgenders who would be a part of a community, you know, who would be a part of a community, who would be peers, who would, you know, play a very important role in normalizing the idea that gender fluidity and all these concepts that we are talking about is important. So it's, you know, we hold a responsibility of bringing up cisgenders as well. So I think that gender neutrality is very important. Also, one more point, we have children who are being raised in a, you know, generation where we have digital, you know, space. They are already exposed to the idea. And when we put a limit to it, we are actually confusing them. So it's very important, because you see, on media we find that it's okay to fail. Failure is the pillar to success. But in our households, what we tell, don't fail. You know, you can't fail. Or if the child fails, he or she or they feel ostracized. That is the confusion. Media is something which we need to include, and I really appreciate, you know, bringing up the idea that, you know, a child needs to be raised in a gender neutral space. So thank you.
Thank you. Sure, Emerson. Somebody will have to run with the mic.
We have one final question or so going. No.
Thank you so much. I think one of the things to note is that my son is very cis. And as much as I might want to try a bit of a joke, because he can be whatever he wants to be, I definitely speak to that he is my biggest advocate. And he holds me to account so often in being able to question, you know, I might be just having a hard day where I don't ask people's pronouns, and he'll ask me why I'm assuming someone's gender, because I've had that conversation with him. And I'll be like, because some days are just hard. But I think one of the things that he isn't confused by who he is at all. And one of the things that I love is that he is educating all of his friends. So all of this, it's this ripple effect of everyone knowing that they can be and whoever they want to be, and almost starting to have that question of then other parents see that they can do that too, that there's permission to be able to have your kid be whoever they want to be and love and support them. And that's what I hope that what I'm doing with my kiddo does.
Thank you. Thank you, Emerson.
Thank you for both of you, the panelists. Like, my name is Rachana. I identify myself as a trans woman, and I'm the technical expert for the transgender clinic, which is run in Hyderabad, funded by USAID and Accelerate project. So yesterday Simran was there. She's my boss.
Oh, wow.
So very interesting discussions happening. I want to just want to, before starting pitching into those conversations, want to say that we, a handful of educated people who are sitting in this room, have been discussing about the guidelines for the surgeries of transgender community, where a major population, which is identified as Hijra, have been outside this room and have not been able to access, or might have not been able to also have a time to sit over here and also promote for these discussions.
Yes.
But I think we will be definitely contributing for something can be changed from the coming generations of also the Hijra community. So, because they have been the pioneers in pushing the boundaries, whether it is Nalsa judgment or other, policy level changes, and I really appreciate those Hijra leaders who have been in forefront in bringing these conversations into practice. Keeping that as my starting thing, two things. Someone said that gender certificate should have, like birth certificate should be in binary, there is some problem, because there are also children who are born as intersex and hermaphrodites. None of us are here, like I think if an intersection person might have been in this room, might have raised an objection, because there is lot of things happening with intersex people and children, and fetus has been aborted, which we often ignore those conversations, and also there are judgments for not aborting intersex fetus also. I don't know how the fetus can be scanned. Actually, we have a law for prohibiting that also. That's first thing. Second thing also is like, as Seema ji said, that like we are confusing the kid more. It's not only the confusing the kid, but also there is an environment which is binary. As the gentleman said, that we are multi-layered as a class, caste, religion, gender, and sex and sexuality, where we often very much silent and have a taboo around sex and sexuality. And we often confuse sex with gender also, which is not true. Both are different. And this knowledge need to be dialogued in a very diverse Indian culture, because it has gone and coming as a culture where transgender community has been taken the shelter under it, being a Hijra community all this generation to generation.
Yes.
They have protected themselves just for being alive. Under the culture, So some way the parents have to be like, will be challenged, like why you are bringing up a kid in such a way that the kid is confused to make a choice of binary. So do we have the answers for that? Do the parents have a situation to face the challenge? Because it's all the allyships where the trans people can feel comfortable, So that comfortable environment, enabling environment, are we going to create, which will somewhere collide with the culture, and which is very bombarded in various directions also. So coming to my, again, I'll put it very clearly. So my few experiences as once I get into a cab, and the cab driver has recognized me as a trans person and suddenly says that, "Madam, now the surgeries cannot be done, And I said, why, how? We got a judgment of conversion therapy, We have read in the newspapers like, oh, is that true? So this is coming from a cab driver, I can understand. When we have a transgender welfare board in Telangana back, and this is coming from a medical university, like medical college professor, that he needs to talk to me about conversion therapy, then the bell rings in my mind saying that, oh, so people, irrespective of their background, feel that conversion therapy is equal to transitioning of transgender people.
Because they're converting, my God.
Of course.
My God, that is exhausting.
So there is a lot of things need to be, decided. Second thing, we in the clinic, we do a memorandum of understanding with the medical experts, endocrinologists and surgeons. And 2 empaneled psychologists in the initial, while have been going for them for MOU, they have been asking that like, oh, some trans masculine man visited to me to get a GID certificate. And she, not even he, she has a partner, a female, cisgender female. How can you give her a GID certificate, she said. Oh, a trans masculine person having a cis partner, female partner, cannot be given a GID? So that's the understanding of psychologists. Another psychologist, this will be very traumatic, saying to me while signing his MOU, like, we need to also assess the, the transgender persons who are coming for GID certificates, there's schizophrenia. That's so disturbing. That's so disturbing, me being a trans person. Why I'm bringing all these conversations and practical experience to these discussions is, there is community whom we call the trans clients. There are medical experts. And both are adamant not to have a mutual concern or sit. Both do not have a time. No, transgender community do not have a time Just they walk into the clinic and say, we want silicone implants, we want surgery, SRS, sigma and colloid, we want facial surgery. That's what.
Yeah.
If you're going to do this, or if not, clinic is no use. This. Yeah. Then we have to run pillar to post. I don't know where that gentleman, Harry Benjamin, is the one, the father of transgenderism. You know, a big clap to him. A big clap to him, because he's the father of transgenderism who have brought this, again converted to the WPATH guidelines, and again we are sitting in the IPATH conference thinking about guidelines. So the clients, transgender clients doesn't have time. They doesn't want to go to the 9 sessions which has been prescribed by Harry Benjamin long back, which conversations has stopped in 2009 itself. And they have been converted to WPATH guidelines. And those 9 sessions within interval of 2 years, nobody talks about that now.
Yeah.
Just they walk in and say that I need the surgery, that's it. And not even mental health professionals know that, like, how this can happen. We want the physical screening. Recently, the medical secretary of Telangana have been on a virtual meeting asking that we need physical training, screening, which 2014 judgment also prohibits actually. And we have get scraps of GO in Andhra Pradesh also challenging for medical screening of transgender people to issue a certificate of transgender. So these are the practical issues. The second side is the mental health experts. I've been on a panel for 14 mental health experts of a reputed organization from South. They said that, like, there is a lot of confusion between sexuality and gender within the mental health experts also, as I said, like. So where we will start actually breaking that binary.
Yes.
So the binary is a challenging thing which is multi-layered and which we need to work a lot around. Last but not the least, finally, like wherever we go with the government, like government simply asks, like, come with a document, come with the guidelines where we can come with a policy. We have nothing has been written on white paper with the black letters saying that so and so person when enter for the transition surgery, this is the starting point and this is the ending point. Yeah. Who all she or he has to go and meet and get those services. That we need very quickly, because nobody is going to, wait after this wave has been, ये जो उठा जो रिवोल्यूशन जो हेल्थ की माध्यम से, ये अभी रुकने वाला नहीं है, क्योंकि ये बहुत मतलब पहलू में जाएगा, बहुत ऊंचा भी उठेगा. So that's from me. Thank you.
Thank you so much.
Can I just say a quick conclusion?
Thank you. There are
quick 2 seconds.
Sorry.
Conclusion? Can I?
Yes. Yes. Why not?
No, because I just think that what ma'am said, it's something that is so important, and that is what I was saying at the start of my thing also. कि हम लोग जो यहाँ बैठे हुए हैं ना, all of us sitting here talking in English, we're standing on the backs of giants. And the Hijra community are those giants. These are people that don't have the time to sit in these fancy halls and talk in English. And these are the people who we are failing, that we are not taking care of. And I think, ma'am, thank you for bringing this up, because even now we talk about transness, हम hijra बोलने से डरते हैं. We feel a little sense of hesitation in saying the word hijra like it's a bad thing. It's not. It's one of the oldest communities of trans people in the globe, like not just India. It's one of the oldest communities of like trans people, and I think it's important to understand that India made the idea of class and caste intersect, and that is why when we walk out of here, we don't just want to think about our clients who are respectable, our clients who come from like English-speaking families. I want us to think about people that we can help that need it the most, and clarity. We don't need to have directives that are worded loftily. Just आपने कहा in black and white. We need to know in black and white when, where, how. Thank you. Because life carries on. People don't have time to jump through these bureaucratic hoops that some of us feel very comfortable doing. And thank you so much, ma'am, because I think this is so important. This is such an important thing that you raised, and I want all of us to like really take that back with us, that there are people out there who need that help, that don't have access to that help, because the language and the framework that we have made around it it's so lofty, it's so fancy, it's so mysterious for no reason, and it doesn't have to be. It should be simple. So I think that is what my conclusion is, Dr. Kavita.
I don't think there could have been a better conclusion, and I'm not sure if this mic is working, but I'm sure you can all hear what I am trying to say. I think it is time to conclude. So I think what I'm feeling right now can't be put into words, but I'm going to try with one line to say that today, I think with this section in the last couple of hours, I am so glad that we managed to make certain things visible and talk about them. I am so glad that Teya, Man, Deepika, Ranjana, and so many others got a chance to speak, because this is what really, I think, can also be the role of a mental health professional. To be an ally, to make things visible rather than talk about knowledge. Because knowledge right now, where trans healthcare is involved, is sparse from the medical experts and is rich from humanity. So that's what I'm taking away, and I'm going to ask each one of us sitting over here to take 30 seconds, not too long of your time, to close your eyes and say, what am I taking away? And can I please request each one of us to make an intention or a pledge, however strongly you feel about those words, and say, what am I going to do when I go out into my community? What am I going to, the one thing that I'm going to do that I'm taking away from this section today? What kind of a dialogue? What kind of an intention? What kind of a pledge are you willing to make? Please feel free to close your eyes. Thank you to each one of you for this conversation and for being such a lovely, interactive and thoughtful audience.
Thank you so much, Dr. Kavita, Arora, and Teya. Please stay back here only. And thank you so much, the audience, for this interactive session, and thank you all for sharing your views and asking questions and all. Ma'am, please stay here only. And I would like to request Professor Shibu Johns to kindly be here to present a memento as a token of love to both of our speakers. I would like to invite Professor Veena Sharma also to kindly join. I request Dr. Amit Sen also to kindly join us for a group photograph.